All right. Let's dive into something that I think is incredibly relevant to, I think, all of us.
Yeah.
Even if it's not like the easiest thing to talk about,
Yeah.
end-of-life care in the ICU.
Yeah.
We're talking about those really intense, often really heart-wrenching decisions that families and medical teams have to face when life is on the line.
Absolutely.
Yeah.
Such a human experience.
Yeah.
And thankfully, we have some really, groundbreaking new guidelines
Yeah.
from the European Society of Intensive Care Medicine.
Okay.
The ECCM published just this year, 2024, to help us kind of navigate these really, really challenging waters.
So you handed me like a mountain of research, but these ECCM guidelines,
Yeah.
they're like the compass and the
Yeah.
map for this territory, right?
Yeah, absolutely.
Yeah.
They've taken expert opinions and the latest evidence from around the world,
Okay.
and they've really distilled it down to this framework
Okay.
for approaching end-of-life care in the ICU.
And, one of the things that struck me right off the bat is how much cultural and legal landscapes actually shape these decisions.
Yeah, for sure.
It's not just about medical facts.
No.
It's about belief systems
Absolutely.
and values
Of course.
and what a good death even means in different societies.
Totally. It
Yeah.
really makes you realize that it's not one size fits all.
Yeah.
For example, in some cultures,
Yeah.
the thought of withdrawing life-sustaining therapies,
Right.
even after they've been started, is ethically unacceptable.
Wow.
So you can imagine the weight of that
Yeah.
on families and healthcare teams as they're making these just gut-wrenching choices.
Wow, that's a powerful example.
Yeah.
It really makes you realize how important it is for doctors and nurses to be sensitive to those cultural nuances. We
Right.
can't just assume that everybody's looking at this
Of course.
through the same lens.
Absolutely. And to add another layer to that,
Right.
the guidelines highlight a pretty concerning gap in the research.
Okay.
We actually have very limited data
Mm-hmm.
from low and middle income countries.
Mm-hmm.
We call those LMICs for short,
Okay.
where resources for critical care are
Right.
often really scarce.
So we're talking about a huge
Yeah.
portion of the world's population potentially facing these situations
Right.
with less research to guide them and possibly,
And fewer resources.
fewer resources. That's a major concern.
It is a major concern. And this research gap really highlights the need for more studies in those LMICs
Yeah.
to understand, the unique challenges they face
Okay.
in providing this end-of-life care when resources are already so limited.
It makes you wonder
Yeah.
if these guidelines, as comprehensive as they are,
Right.
can they really offer like a one-size-fits-all approach
Right.
when you consider this global variation?
That's the beauty of them. They don't pretend to have all the answers.
Okay.
Instead, what they do is they offer a framework
Okay.
that stresses flexibility and cultural sensitivity.
Okay.
It's about starting the conversation,
Mm.
understanding the patient's values and their wishes,
Right.
and making sure that we are respecting those wishes
Right.
within their own cultural context.
So it's not about rigid rules.
Well,
It's about those guiding principles
It's
that can
right.
be adapted.
Mhm.
And these guidelines, they seem to really encourage that open communication, that shared decision-making between families, patients, and the medical team.
it's about recognizing that there is no one right way
Right.
to approach these situations.
Yeah.
Every single situation is unique.
Yeah. Every patient,
That's
every
right.
family
Every single one.
this is different.
And that's okay.
And that makes sense.
It's not about imposing decisions.
Yeah.
It's about creating that space
Yeah.
for open dialogue
Right.
and compassionate understanding.
Which leads us, I think, to the heart of these guidelines,
Okay.
and that's decision-making in the ICU.
Yeah.
We're talking about decisions that carry so much weight, And these guidelines really emphasize this idea of shared decision-making.
Right.
It sounds like a very collaborative approach,
It is.
more than I might have thought
Yeah.
for this kind of environment.
So imagine a situation where a patient's condition is, deteriorating,
Okay.
and some difficult choices need to be made about life-sustaining therapies.
Okay.
And these can be,
That's right.
complex interventions like
Okay.
using a ventilator to help someone breathe,
Right.
medications, dialysis, things like that.
Okay, so that makes it much clearer having those
Yeah.
specific examples.
Sure.
But with so much on the line,
Yeah.
how do you even begin to navigate those conversations?
Well, that's where these structured decision-making strategies really come in.
Okay.
The guidelines offer like a roadmap
Mm-hmm.
for these conversations.
Okay.
They make sure that everyone's on the same page,
Right.
the patients, the families, the medical team.
Yeah.
It's about creating that space where everyone feels heard,
Yeah.
where information is shared honestly and openly,
Right.
and then ultimately decisions are made together.
It sounds almost counterintuitive,
Yeah.
bringing this much collaboration into
Yeah.
such a technical and emotionally charged setting.
Right.
Is there evidence that it actually leads to better outcomes?
There is. Research shows that when patients and families feel more involved in that decision-making process,
Okay.
they are more satisfied,
Right.
even when they're facing these really difficult choices.
Right. And it's not even just about the final decision,
Yeah.
but it's the feeling of being respected, of being informed, of being empowered.
Absolutely.
And that makes a lot of sense.
Yeah.
And it kind of brings to mind something else that really stood out to me.
Right.
This idea of making sure that families really understand the implications of decisions about life support.
Absolutely.
I mean, these are complex medical interventions.
For sure.
It's easy to feel overwhelmed.
The guidelines are very clear on that point.
Yeah.
Before any decisions are made about continuing withdrawing or even withholding
Right.
those life-sustaining
Yeah.
therapies,
Yeah.
families really need to understand what those therapies actually mean.
Right.
What do they entail?
Yeah. What are the benefits? What are the risks?
What are the potential benefits and risks?
Yeah.
What do they mean for that patient's quality of life?
Mm-hmm.
It's a lot to process, especially in the midst of all of those emotions.
It sounds like these guidelines are kind of advocating for a real shift
Yeah,
in how we think about end-of-life care in the ICU.
they are.
It's not just about the medical interventions themselves.
It's about humanizing that experience
Yeah.
for everyone involved.
And I think that's a really important distinction.
We're moving away from a purely clinical approach
Right.
to something that recognizes those deep emotional and spiritual dimensions of end-of-life care.
And a key aspect of this humanization, has to do with palliative care.
Yes.
And I'll admit, I used to think of palliative care as something that was kind of reserved for the very, very end,
Right.
when all other options had been exhausted. But these guidelines seem to challenge that assumption.
They do. They really do. What's interesting here is that they're suggesting that we introduce palliative care
Okay.
much earlier in a patient's ICU stay.
Okay.
And that can actually significantly improve their comfort
Wow.
and their quality of life.
Okay.
It's about managing their pain,
Yeah.
relieving those symptoms, like shortness of breath,
Mhm.
addressing their emotional and spiritual needs,
Right.
all alongside any of those ongoing treatments.
So it's not an either or.
Exactly.
It's about integrating these different approaches
It is.
to really provide the most comprehensive and the most compassionate care.
Exactly.
And that's regardless of the eventual outcome.
It's recognizing that even in the ICU, where we're so focused on those life-saving measures,
Right.
there's always more that we can do to relieve suffering and to enhance a patient's well-being.
This is starting to feel like less of a medical textbook and more like a guide to navigating these incredibly difficult situations with both expertise and humanity.
That's exactly what these guidelines are trying to do.
Yeah.
And they even go into specific tools
Okay.
and strategies that can really make a difference
Okay.
in the day-to-day experience of the patients
Right.
and their families,
Yeah.
even the ICU staff themselves.
Okay. Now you've got my attention.
Yeah.
What kind of tools are we talking about?
Well, let's talk about something as simple as communication aids.
So those tools you mentioned, what kind of things are we talking about?
Now, the guidelines actually strongly recommend using things like brochures, leaflets, even to help families really understand, that complex medical information
Okay.
and kind of navigate that decision-making process.
Okay.
And you might think, well, that seems so simple.
I was going to say it. Yeah, I might not have thought of that
Yeah.
as being so impactful.
It's easy to kind of overlook these things,
Yeah.
but imagine being in that position.
Right.
You're in the ICU.
Yeah, it's overwhelming.
It's overwhelming. There's all these, medical terms being thrown around.
Right, and huge decisions.
Huge decisions being made.
Yeah.
So to have clear, concise information,
Right.
easily accessible,
At your fingertips. Yeah.
can be really empowering for families.
Absolutely. It's about
Aye.
giving them the tools to understand,
Exactly.
to ask the right questions,
Yes.
to feel more confident in that process.
And these guidelines actually go a step further.
Okay.
They emphasize how important it is to train ICU staff
Okay.
in effective communication skills,
Okay.
specifically for end-of-life care.
So it's more than just, conveying the medical facts.
It is. It's about creating a space for that open and honest dialogue.
Right. That compassionate communication.
Absolutely.
Right.
And it's also about being aware of those nonverbal cues, making sure that we're hearing the needs,
Right.
even of patients who can't easily communicate them verbally.
Right, because not everybody can advocate for themselves in that moment.
Exactly. And did you know that the guidelines actually suggest using standardized symptom assessment tools in the ICU?
Tell me more about that.
So picture this.
Okay.
A patient who is sedated, or maybe they can't speak clearly for whatever reason. These tools give us a really structured way
Okay.
to assess for those subtle signs of pain,
Okay.
anxiety, discomfort,
Right.
things that we might miss otherwise.
That's a really good point.
It's about constantly making sure
Yeah.
that we're advocating for that patient's comfort,
Right.
for their well-being, no matter what.
It's like giving a voice to the people who don't have one in that moment.
Exactly. And it all comes back to this idea of humanizing that ICU experience.
Right.
The guidelines even address things like visiting hours.
Okay.
They recommend that we move away from those really strict limitations
Yeah.
and move towards something that's more flexible, more family-centered,
Right. It makes sense.
especially as patients approach the end of their lives.
Yeah. You want family there. You want them to be comfortable.
Exactly. It's about recognizing that families,
They're not just visitors.
they're not just visitors, they're an integral part of that care team.
Yeah, absolutely.
And even for families who can't be there physically.
Right. Not everybody can be.
Maybe they live far away.
Right.
The guidelines suggest things like video calls
Oh,
to try to bridge that gap.
that's so important, especially now when
Yeah.
we are so much more connected with technology.
Of course.
It's encouraging that these guidelines are embracing that.
Because compassion and human connection,
Mm-hmm.
they go beyond those physical limitations.
They really do. And speaking of connection,
Yeah.
the guidelines also touch on something that I think is often overlooked:
Yeah,
bereavement support for those families who've lost loved ones in the ICU.
absolutely.
Yeah.
And this is a really critical piece.
It is. What kind of support are we talking about?
Well, interestingly enough,
Okay.
they actually recommend against sending those routine condolence letters
Really?
from the ICU team.
I wouldn't have even thought about that, but it makes sense.
It seems counterintuitive, but
Yeah.
the research suggests that those letters can sometimes feel impersonal,
Right.
even hurtful,
Yeah.
especially if the family's experience in the ICU was difficult.
Right, because everybody's experience is going to be unique.
Exactly. It's not one size fits all.
Oh,
So instead of those generic gestures,
okay.
the guidelines really encourage a more personalized approach
Okay, how so?
to bereavement care.
Okay.
This might look like offering families, maybe a meeting with a care team
Right.
before the patient dies, or
Uh,
even after,
uh.
maybe providing them with resources for grief counseling, support group,
Support groups. Yep.
or even just offering a listening ear,
Right. Just being present.
being present, validating what they're going through.
And we can't forget about the well-being of the healthcare professionals
Of course.
working in this really intense and emotionally demanding environment.
They're the ones on the front lines.
They are. What kind of support do the guidelines suggest for them?
Well, they recommend a few things. Conflict management training
Okay.
to help staff navigate disagreements.
Yeah.
Those difficult conversations,
Right.
especially in these high-stress situations.
That makes sense.
They also highlight how important it is to foster a supportive work environment
Yeah, just feeling supported.
where people feel comfortable asking for help when they need it.
Absolutely. These guidelines really do offer a new roadmap for navigating this really tough terrain of end-of-life care in the ICU.
Yeah.
And they encourage us, I think, to move beyond just the purely medical model
Yeah.
to something that embraces a more human-centered approach.
One that prioritizes that open communication, the
Right.
shared decision-making, and really emphasizes compassion
Compassion for everyone.
for absolutely everyone involved.
So as we wrap up this deep dive, we're left with a lot to think about.
A lot to ponder.
If you were designing an ICU from scratch,
Oh, wow.
what would you prioritize to ensure the most compassionate and the most supportive environment for
Wow.
patients, for families, and for the incredible healthcare heroes who are caring for them?
It's a big question.
It is. It's a really important one.
It is.
And it's one that we should all be thinking about
Yep.
as we navigate these really complex and very human issues.
For sure.